I'm Courtney Taylor, Grants Program Officer Community Partnerships for the York County Community Foundation, where I also support the York County Nonprofit Collaborative. You may have noticed a QR code on the screen as you entered the room, or maybe not, but we're very interested to get your feedback on the collaborative. If you've already taken a moment to fill out the brief survey, we thank you and we truly appreciate it. If not, the QR code will be displayed again at the end of the program, and we would welcome your input. I'm happy to see many familiar faces, as well as some new ones, and I'm glad you chose to spend a part of your morning with us. Thank you for the work you do every day to strengthen our community. We value your partnership and presence here. Today is all about York County data and the stories it can help us tell. Data helps us see patterns of impact, highlight opportunities, and understand the realities behind the numbers so we can better serve our neighbors. That's why we've brought together experts from across our community to share a variety of complementary data sets, giving us a clearer picture of York County's needs and trends. Before we get into those presentations, we're going to share a few updates on the York County Nonprofit Collaborative and the York County Community Foundation. Since our last update in October, the York County Nonprofit Collaborative has continued advancing its goal of increasing nonprofit capacity and resilience. In addition to ongoing programming, there has been significant work behind the scenes to develop new opportunities to better support the sector. One of our biggest milestones was the January launch of the Shared Services Work Group. To share more about this work group, I'm pleased to welcome the co-chairs, Jessica Brubaker and Rolf Prep.
Hello everyone. So Jess and I are honored to be co-chairing the still fairly new Shared Services Work Group. Not to brag, but it's a really great group made up of individuals with a range of diverse experiences and perspectives. We've met so far twice, and we couldn't be more thrilled with everyone's level of engagement and the wisdom that they bring to our discussions. In terms of our group's work, we view our mandate as exploring opportunities in ways that will broadly impact and benefit the nonprofit sector overall. In particular, we have focused on solutions that would particularly benefit small and medium-sized organizations, many of which are volunteer-led and lack staff capacity. As a group, we have chosen to conduct our work on parallel tracks, balancing real early wins with efforts to tackle ambitious solutions to big problems that are more complex and will take longer to implement.
Thanks, Rob. Specifically, we've broken opportunities down into 3 categories. The first is strengthening what already exists to support the sector. So this would include driving more traffic to and ultimately increasing the utilization of the new bulletin board. How many of you have visited the bulletin board yet? Okay, that's not enough. So we're gonna work on that. Through which nonprofits can crowdsource information and solutions to problems, identify resources, get recommendations, and make really valuable connections. We want to help the bulletin board become the first stop, the go-to place for nonprofits to turn to when challenges and questions arise. So if you're having an issue, someone else has probably had a similar issue, and you can reach out for guidance or advice. They might be able to help point you to resources or set you on a really helpful path. The second category is tackling some low-hanging fruit so that we can have some early wins and really deliver something quickly to benefit the sector. We don't want to just plan and talk for months and months and years and years. The most promising opportunity here is developing a vetted bank of experts, professionals with nonprofit experience who will take your call when you have an issue that requires specific expertise or a particular skill set. So maybe you're having an HR or employment related challenge, or you're struggling with something RACP related, which I would be happy to talk to anybody about, or any kind of question that might arise, and you want someone who you can call without needing a really long engagement, but who has some really specific expertise and they can help you. And finally, the third category is exploring some longer-term big ideas with the potential for truly transformative impact across the sector. These require a lot more research and vetting and planning. Some of these big ideas include benefits pooling to assist with talent recruitment and retention, and having larger organizations provide back office functions to support smaller organizations. As you can imagine, these particular areas require a lot more exploration and research and vetting and discussion, so those will take a little bit longer.
Okay, so everyone, we look forward to working through these opportunities in the coming months and delivering some tangible, meaningful shared solutions to the sector. We'll keep you posted, and we also invite you to join us, so always feel free to reach out to us, because we will enjoy those conversations and be able to bring that to the groups as well. Thank you.
Thank you, Jessica and Rolf. We're excited to see what shared solutions the group comes up with. One of the challenges that emerged from the nonprofit landscape assessment was related to board engagement, governance clarity, succession planning, and shared leadership. In response, and through a partnership with Leadership York, we're excited to announce Board Forward, a 6-month program designed specifically for executive directors and board chairs to strengthen how they lead together. We'll bring together up to 8 leadership pairs for expert-led sessions, peer learning, and dedicated working time on the second Wednesday of each month from May through October. You'll leave with a clear action plan, stronger governance practices, and practical tools you can implement immediately. Not theory, but real progress. Whether you're a new executive director, an ED navigating recent board transitions, an incoming board chair, or a current chair with at least 2 years left in your term, or simply a leader ready to strengthen governance practices and invest in long-term strategy, this program is designed for you. Applications are due April 3rd, space is limited, and we hope you'll consider being a part of this inaugural cohort. If you're interested in learning more about the program or know somebody who might be, our staff left these half sheets on your chairs, and there's a QR code on the back with more information that you can scan or you can share it. Speaking of new opportunities, our policy and advocacy work group has drafted 3 position papers outlining the collaborative stance on 3 key issues: economic opportunity and quality of life, health and human services, and nonprofit funding and sector stability. You can find these resources on the collaborativeyork.org website, and we encourage you to review them and use them when appropriate in your advocacy efforts. Now, if our October elected officials panel or last year's state budget impasse got you ready to take action, we have a great next step. We're offering an Advocacy 101 webinar on March 24th at 2 p.m. You'll learn the basics of nonprofit advocacy, how to engage decision makers, and leave better prepared to influence policies that impact our community. Register now using the QR code on the screen. We hope you'll join the live session with Q&A, but if you can't attend, we do plan to record it and post it on the collaborativeyork.org website. Meanwhile, if you've applied for a project grant through the Community Foundation, you may have noticed an option to use your Give Local GLY 365 profile link, instead of answering some of the most common grant application questions. If you appreciated this option, you can thank our grant application streamlining work group. This group is gathering feedback from nonprofits who use the process and will continue working with funders to expand adoption of these shared questions throughout the year. Powder Mill Foundation also recently added this option on their new online application. If you have feedback to share as an applicant about this new process, please reach out to the Community Foundation's grants team. Our Peer Power Networking series continues to bring nonprofits together in person for compelling conversations. We meet monthly in York City at 8:30 a.m. and quarterly in Hanover, with the next event in June. We're also planning a new gathering soon in Southern York County. These intimate events are all about sharing knowledge, sparking collaboration, and building connections that support you in your work. If you haven't joined yet, now's the time. Peer Power is for all nonprofit staff, from leadership to program and development teams, and for organizations of every size. And you can keep these conversations going online. The bulletin board on collaborativeyork.org was designed to be a place where you can ask questions, swap ideas, and share resources. And as Jessica mentioned, we want this to be the go-to place for nonprofits when they have questions. Be sure to check it out, and there's also a QR code on that handout for that. That was a lot of updates, but we're not done yet. In the spirit of transparency and collaboration, we did want to share the Collaborative's annual calendar, and what's ahead for the rest of the year. While not every date is set in stone, you can look forward to an AI Lunch and Learn, a fundraising cohort, additional advocacy training, and new partnerships with York College of Pennsylvania, including their program evaluation cohort, which is currently accepting registrations. Later this year, we also hope to offer an AI cohort and another grant writing mini course. The best way to stay informed of all the new and upcoming opportunities is to sign up for the Collaborative's newsletter. It's your go-to source for updates on grants, events, policy and advocacy updates, and leadership development opportunities. So if you're not signed up, you can do so via the QR code or see me after the meeting. Now I'm going to turn things over to Natalie Gunderson to share brief updates on the Community Foundation.
Awesome. Thanks, Courtney, and thanks to the whole collaborative. You guys are doing great work. And we at the Community Foundation are so proud to and happy and grateful to be the backbone of the collaborative. A lot of great things happening. Again, I just wanted to share a couple updates about the York County Community Foundation. And this year we are actually celebrating 65 years of service in York County. And we invite you to celebrate with us throughout the year. You'll see us at the St. Patty's Day Parade this weekend. We've got some activities planned in Hanover and our annual meeting coming up on May 7th. We hope you join us at the Yorktown. In 2025, our board and staff, actually in our community, we involved some community members in that discussion as well, helped us develop our next 3-year strategic plan. And we really appreciate it for the board and the staff's commitment to that process. At the core, our mission remains the same. We are going to bring people together, connecting those who want to give with the needs and opportunities in our community, and with a focus on endowments for our community forever. Over the next 3 years, we will be even more intentional about strengthening collaborations among nonprofits, addressing key community issues, and focusing our grant-making efforts on impact. For our discretionary grant making, our focus areas are housing, workforce development for younger adults, and child and youth development. We're excited to embark on this journey with these renewed focus areas, and not just for YCCF's next chapter, but really for our York County, and the place we all love and call home. So far in 2020, I'm going backwards instead of forwards. So far in 2026, that's not 2025 grants, it's 2026, we've actually awarded at YCCF more than $600,000 to 129 grantees. So thank you to each of you who have put in a grant application, who have met with our grants team and allowed us to make strategic investments in our community. In 2026, let me find the page here. I don't follow my notes. That's why Sarah gives them to me so that I stay on task. Anyway, so in mid-April, those of you who have already applied, you'll be communicated the decisions for those grants by the end of March. In mid-April, applications will open for this final round for 2026 grants that will support projects between November 15th of this year and April 15th of 2027. Information is available via our website. And be sure that you're subscribed to the newsletter, because we also include grant deadlines and grant information in the newsletter, not just for YCCF, but for other local funding opportunities. As a reminder, all grant-making funds stewarded by YCCF now share the same deadlines, so you don't have to worry about following our multiple deadlines. You can simply focus on your mission and just have 1 or 2 dates in mind. Last year, another thing that YCCF was able to complete was York County actually completed its first 5-year age-friendly plan under YCCF's leadership, thanks to Kathy Bollinger and all her work over many years. And because of that commitment, York County had the honor of hosting the announcement that Pennsylvania became the 13th state to join the AARP World Health Organization network of age-friendly states in May of 2025. We can't say that too fast. In 2026, and with this expanded commitment at the state level, we are partnering with the York County Planning Commission more strategically over the next 5 years to work on strengthening housing, transportation, business development, and overall quality of life in York County. On Friday, March 20th, we do have a working session focused on age-friendly principles, and we invite you to join. If you would like to join, Kathy, if you could raise your hand. Kathy Bollinger can answer any questions about that upcoming event. We've also added some new team members. We've got Lisa Gallagher and Bob Bentley as joining our team as gift planning officers to help all of us, not just YCCF, but again, the nonprofit sector, continue to build endowment for our missions today and for the future and for our next generations. We've also added Justin Keach on our accounting team. In 2025, we also started the partnership with other regional foundations or other foundations, Lancaster, Adams County, Partnership for Better Health, and the High Center that's also here represented. We started a partnership to create the Susquehanna Nonprofit Summit in Gettysburg in April. The response has been overwhelming. We actually reached capacity in 4 days, and there's a wait list of over 100 folks. Given that interest, we believe that the collaborative work that we started here in York County was actually the catalyst for that regional work. And again, given that interest, we're going to continue to think about ways that we can bring some of the topic areas and some of the discussions that are happening at the Nonprofit Summit and across the region into York and back out for partnerships, not just in York, but also across the region. At YCCF, our vision is a vibrant York County where everyone can thrive. And again, that's only made possible because we have wonderful partnerships with each of you in this room and your organization. So thank you so very much for your partnership, for your resilience. I mean, we just don't give up. This sector is here, and we're here to stay, and it's great to have the partnership amongst so many of you in the room. So you're done hearing me. Let's get to the real meat and potatoes of this meeting. Again, we believe countywide, and to Courtney's point earlier, we believe community data is what will help us continue to make informed and strategic decisions, not just for programmatic work, but really for our funding investments across the county. So when we understand the data that's shaping our community, we can strengthen our programs, improve collaboration, support advocacy, and enhance reporting. And we can make stronger evidence-based investments. Today we'll hear from Natalie Williams from the Healthy York Coalition on the Community Health Needs Assessment. We'll hear from Jenny Englert, President and CEO of Family First Health, and she will specifically share on information about Connect York. Laura O'Grady, Vice President of Impact and Strategy for United Way of York County, will share on PA 211 and ALICE data. And then David Gonzalez, Director of Economic Initiatives and Advocacy for the York County Economic Alliance, will give an update on the Economic Action Plan. We're going to hold our questions until all of the speakers have gone through. So if you want to jot down questions that you have throughout the presentations, that's great. And first, we'll welcome Natalie Williams.
Okay, good morning everybody. So I have 10 minutes this morning to go through this data, so it's going to be fast and furious. And when I was thinking through some of the goals of this presentation, really, how many of you have used the Community Health Needs Assessment data in your work? Okay, I'm going to repeat what Jess said. That's not enough, but thank you. Thank you so much. So really, it's obviously an awareness that the data exists. We've been conducting needs assessments in our community before it was required by the IRS. So we really are a beacon here in York County. And so as I'm going through this presentation, this high-level overview, I want you to think about your organizations, your board, your committees, and really how this data relates to the work that you do every day, but also if you think that there's an opportunity to maybe have myself or someone from our organization or steering committee come and chat with you, right? Because this is, again, a very quick snapshot, and maybe there's an opportunity to go a little bit deeper with some of this information. So these slides are really small. I'm going to preface this by saying I did bring some handouts, so if you can't see some of the things today, but a lot of this information is located on our website, and I guess you're gonna get a copy of the slides, so that'll be great. All right, so Healthy York Coalition assesses health needs, convenes community partners, and facilitates action towards better health for all. Have to throw in our mission statement there, really important. Like I mentioned, the Community Health Needs Assessment is an IRS requirement that each hospital entity location conducts a needs assessment, right? And so the importance of the needs assessment is really in identifying and prioritizing health needs of the community, including those medically underserved, low-income, and minority populations. It gives each hospital the opportunity, or in our instances, communities, right, to really develop an implementation strategy of how they're going to invest dollars, and really how they're going to fill specific needs within our community. It does also provide information for us to collaborate and to focus allocation investment appropriately. So those are just some really purposeful statements there about why we need it. So today I'm going to talk a little bit about the methodology from WellSpan and their CHNA process. But know that when I have another slide coming up, but I just wanted to preface that the methodology today I'll talk about is really with the WellSpan Health Needs Assessment, and which really, from my expertise in looking through needs assessments throughout our region, right? We have more than one entity, hospital system entity that lives or practices here in York County. We really do have a blessing in WellSpan in that they are the only organization that uses both primary and secondary data to inform the assessment. So what does that mean? It means that they're surveying members of our community directly in multiple languages, so English, Spanish, Nepali, and Haitian Creole, right? And so the purpose of that is really to make sure that we're hearing from everyone in the community when we're developing this survey tool and looking at this data. So really the Community Health Needs Assessment includes multiple things, right? I said primary data. So what is that? That's the behavioral factors, risk, the breakfast survey. So it's behavioral risk factor surveillance system. Okay, so say that many times. Okay. Which is basically a survey tool that's developed by the CDC. So it is a framework that the CDC uses. And so many of you in this room may have gotten a phone call from Franklin and Marshall or some lovely individual that says, hey, can I ask you some health questions? If they ever call you, you absolutely have to take the 10, 15 minutes to answer all of those questions. So you'll remember my face when they say, hey, can I ask you those? Right, and so what does that do? What is that survey? So that survey goes over health behaviors, your demographic information, and there are some social determinants of health, randomized questions as well that are asked. So that is really the primary data, right? So the primary data for collection. Then of course secondary data is other local sources of data, state and national, right? And so all of this combines into making the health needs assessment. All right, let me make sure I got it. All right, so, wait, I'm missing a slide. Okay, well, that's okay. All right, so again, I just wanted to tell you the slide that's not in here really shows the other health needs assessments, and just making sure that you understand that we're always looking at all of the assessments throughout York County. Okay, so this is some information that I'm sure all of us are experts in this room. We know our community, we work in our community. But a couple of data points that I think are really important to highlight is, I'm going to use the pointer, let's see if I can get this right. All right, so our median age of 41 here in York County is higher than the state and national average, but obviously comparable to some of our other counties around us. Our median household income is higher in York County than the state average. However, unfortunately, you can see through these numbers that economic disparities exist, both with Black and African American households and Latino households, because we look at the median household income here of $79,000, and unfortunately, obviously, we look at the significant disparities in that.
One of the things that I think is we always look at as a health coalition is the Robert Wood Johnson Health Rankings. And so I'm not going to be able to go in depth as to everything that's included in the Robert Wood Johnson Health Rankings, but it is an important barometer for our community's health. And unfortunately, I don't have great news to share there because that number is not getting any better. And so we have dropped from 19th in the state in 2021 to now 31st in 2023. So that is really unfortunate. And in the actual full report, it does give you all of the different categories to how those decisions are made. And I'll go over some of those today. Oh, someone just got a Teams message. I hear that in my sleep, right? Don't we all? Okay, so again, most of you can't read this, but I do think what's really important is that one of the best things about the needs assessment, as I mentioned, we've been doing this for a very long time in our community. And so we have real longitudinal data that really shows us from the survey, the breakfast survey, right? What kind of things are getting better in our community? What kind of things are staying the same? And these little trend lines here really help us to identify what is getting better, what's staying the same, and not to be a Debbie Downer, but like some things just are not getting better in our community. And we see that both locally, nationally, and a couple things I just thought I would highlight, right? There are some bright spots in this data, in this breakfast, and these questions, right? So we think about these are behaviors. So these are health behaviors. So one of those bright spots is adult smoking. That makes a lot of sense that would decrease, right? As a society, we're not really smoking as we used to. They've decreased significantly over several assessment cycles. So all that preventative work really is happening, at many levels. And thankfully, individuals are getting their yearly checkups. Really, since the pandemic, we saw that number, increase. If people were very afraid to go to the doctor for their annual checkups during the pandemic, makes sense, right? And so they have obviously resumed that. But unfortunately, for every bright spot we have in our community, we also have another kind of health indicator that really says, So I said that adult smoking is obviously, getting better, but unfortunately, vaping rates have increased, right? And individuals are utilizing marijuana at a rate that they never have before. So sometimes, again, you have to really take these things and look at them through the lens of strategy and think through kind of what's happening versus the data that you have. One of the things that I think is really important is that through this survey, we have had the opportunity to ask additional questions, and so we collect data for certain questions. I'll go over a couple of those, but as you can see, we don't have trend data for a couple items here, including vaccines, the loss of a loved one, stressed about money, all of those things. We kind of came up with some questions along the way as we were developing this survey. So I think those are important, right? We want to stick to the theme, but we also want to understand trends over time that are impacting our community. All right, so now on to some additional themes of the needs assessment, right? So again, try to think through how this is in your lens of the work that you do, or things that you see in your family or across the community or the people that you serve. So in our county, the most prominent health concerns are lack of exercise, obesity, mental health, and physical health concerns, and heightened stress from financial hardships. How many of those sound surprising? They unfortunately really are not. And so, I can't even read my own slides here. Let's see here. So we continue to see an increase in individuals who are having poor mental health days. 51% say they have a mental health day that's not good, at least once a week. And 9% of our population, unfortunately, has deemed themselves depressed. And so, again, we can see that how it plays out here locally. How many of you think that you exercise, or how many of you know that you exercise 30 minutes a day, 5 days a week? I would for sure be proud to be raising my hand for that one, okay? But again, that is a common thing that we see in our community. You know, individuals aren't exercising at the recommended rate. 71% of our population is obese or overweight. That number has stayed consistent over the past couple assessments. And so we think through kind of what does that mean? What kind of prevention strategies do we have to encourage people to exercise? All right. Let's see. Our physical environment, again, this is a marker with Robert Wood Johnson. Data is that, you know, we rank unfortunately 50th in the state for our physical environment, which includes air pollution, commuter traffic, housing challenges, water quality, and so that physical environment number is really a number that is very concerning, right? What does that mean when we translate that to health? So what does that mean for people who we have poor air quality? How does that affect asthma rates in youth, right? And so we think through all of these things and the organizations that do important work. Vaccinations is one question that we asked during COVID. And I'd like to just give you a tidbit. I think we can all see how this is kind of playing out at a larger level. During COVID, we did ask the question, do you believe vaccines are safe and effective? And that number came in at around 13%. And in this last assessment, we had that number did go up a little bit to 15%. Not a huge increase, but more people are answering that they are concerned that vaccines are not safe and effective. So again, you can kind of see some of these trends over time. All right, so we do have obviously a portion of children's health. The survey is done, the breakfast survey is asked of adults, but there is a portion of the assessment where secondary data is looked at for children. So really important in our community. So 1 in 3 children from kindergarten to 12th grade are obese or overweight. 13% of children living in poverty lack access or have access to quality pre-K. I'll just keep going with some of these stats. 24% haven't seen a dentist in the last year. That's very concerning. 11% don't have a PCP, and 10% have skipped healthcare because of cost. So what does that mean? Well, in our survey data, it also shows that 30% of our community has a high deductible health plan. So if they're going to the doctor and they have a high deductible plan, you know, those kind of things are concerning, especially when we think about our community's hardship financially. So majority of our community, over 50% are stressed about money. A lot of people have had economic hardships, and 49% of people identify that they have experienced trauma. So think through really how that provides a lens in the community for how you would live through your daily life when it comes to your health. All right, again, this is hard to read, but I really think this is important and something that we do in this assessment that shows the relationship between varying types of demographic status and health behaviors. And so this is the relationship between each of the survey indicators and the demographic indicators. So the darker the color, the stronger the association between those subgroups. So for your county, you can see age, depression, poverty, and race emerge as the most significant sources of disparity across several health indicators. It's also worth mentioning that psychosocial indicators related to depression, trauma, and discrimination produce high association with certain health behaviors, which is a recurring through line in this morning presentation, indicating overall mental health of our community, which is concerning. So again, it's really, these things are hard to see up here, but it's really great if you can kind of take a look at them and think through how is the work that I do each and every day, you know, really related to if I'm dealing with some individuals who may have poor mental health, or how do we talk to them differently about their health? How do we work on prevention strategies, you know, to navigate how we might think through things a little bit differently. So again, you'll get the links to this survey or this PowerPoint with all of these. I will tell you that we do have the York County Health Needs Assessment, which is a smaller assessment from some of these health systems on our website. So you can specifically only look at York County data, which is great, right? Our hospital systems are regional, and so their assessments are quite large, but we do have that down into York County data if you'd like to take a look at it. So here's my contact information if you'd love to get in touch. One of the things that we'd like to accomplish as a health coalition is really just making sure that we're talking about the needs assessment and informing our community about what are some of those really key critical issues that we all need to work on together. So I guess we'll take questions later. Thank you so much.
Good morning. I am glad to be here this morning to talk to you about some of our work at Family First Health and beyond, because many of you participate in Connect York. And some of you may be wondering, what was Family First Health's interest in providing some backbone services to the Connect York service? And that really is rooted in the fact that health and basic needs are interconnected. And so we know that we can do great work all day long providing medical care, dental care, and that if people don't go home to a stable house, if they're worried about where they're going to get food, their health, the progress towards their health goals is limited. So we partnered to bring Connect York, which is a very local, local, specific to York County, online service inventory. So anyone, service providers, as well as community members can access information about services online at any point in time and be directed to things that they and their families might need. When I look at the data, and I'm going to share some data, and I'm also going to focus a bit on what the data is telling us and really the questions that it's raising for all of us at a community level. But the vision that I want to paint is that the data is showing us that thousands of people across York County each year are reaching out through tools, via phone or the online platform, to search for services. Most often, those individuals who are searching for service, the mom who's looking for food to get her family through the weekend, the person who just received the eviction notice or is having trouble making their rent payments, the data tells us that these are upstream folks. These are people who are not necessarily connected into the system. This may be their very first time reaching out for help. So these platforms are really important. We all know as service providers, as hard as we try, systems are difficult to navigate. And particularly when you're stressed and strained with the activities of life, thinking about how to navigate our delivery system can be very, very challenging. So these low challenge thresholds or inroads into the great services that we have in this community are really, really important. And when I say thousands of people, this data is for 2025, and this does include data from 211. So this is both the online Connect York offering and then the telephone service through 211. You're going to get a bit of a deeper dive with the expert on 211, Laura, and from United Way, but this data is kind of combined to give us a real sense of no matter how somebody chose to access this information, there are over 9,000 people last year that accessed services through one of these forms. That included 7,800 individuals that were connected to service, so they gave some indication through the tools that they were following up, that they were connected, and that resulted in over 15,000 referrals made to organizations. So that number always impresses me, that there are thousands of folks that are using these tools every day. When we look at what they're actually asking for, so the words that they type into the search engine, which is one of kind of the nice things on the online tool. So they are saying specifically food pantry, help finding housing, help paying for housing, emergency food, mental health care, and specific under mental health care, and I'll reference this a little more explicitly later, but it's explicitly comes to the surface, mental health care for adolescents or teens or young people. So that tends to be the target there. And then temporary shelter. And I'll dig a little bit deeper in those things, but those are the terms that people are actually using when they go into the services to look for things, which I think is always important. So most requested needs. So no surprise to anybody in this room that housing ranks right in the front. And so specifically, people are asking for short-term rent or utility assistance when they kind of dig a little bit deeper in the tool. These are kind of specific to Connect York, where we can get a little bit more granular. And so short-term rent or utility assistance. So this is the person, and I pulled one search exchange specific to this area in housing, and the person described being on the verge of being evicted, having had a health condition that kept them out of work for 3 weeks, and just needed somebody, literally they typed in, I just need somebody to help me with rent for a month or two to keep my family housed. So, and then hotel vouchers, hotel motel vouchers, so somebody that finds themselves in that really dire situation looking for temporary shelter, and then utility payment assistance. Next is food access. And there we see some things that the food pantries didn't surprise me, but home delivered meals we see really come to the surface. And these are when we track with age and gender. This is across all ages. So obviously we know there's some transportation challenges across our very geographically diverse community. And so that home delivered meal piece is important. Next is health, and really that focus on mental health services. As I said, counseling, teens, adolescents, young people. Another entry that I pulled talked about was a family looking for resources for a 4-year-old who was not able to stay in daycare because of disruptive behaviors, and they were looking for mental health care for that child through the service. Next is benefit enrollment, understanding Medicaid or Medicare, or a lot of, I just lost my health insurance. What do I do? So that's a really important one for us to understand. And then one that did kind of surprise me, durable medical equipment. Specifically, what rose to the surface were several hundred people looking for support with incontinence supplies. So these are the kinds of things that the data can really help us understand, because as people are searching and prompted to kind of get more and more granular with what they're sharing so that they can get connected to the right resources, those things are of interest to us as a health center. Other kinds of durable medical equipment were things like crutches for short-term needs, wheelchairs, scooters, some of those kinds of things fall in that area of durable medical equipment. And then transportation, specifically car repair and car payments. We are doing some great work in this community in this area. I see some partners here that have really jumped into that more recently. Car repair is really at the top of that list by far. So we have some places to actually connect people where I think some other communities really have a gap there. So we have a bit of a lead on that. And then just general financial support. So that was all kinds of things where people were just finding themselves running a little bit short, and if they had help in one area, then maybe they could keep their housing stable, was kind of a theme that emerged. What I'd like to underscore is that most all of the things that are surfacing through the searches and the tools are about basic needs. So these are stability-related kinds of services. And you know, what's been interesting for me, having been at this work for a little while, is that we, probably 10 years ago, I started to see a shift towards thinking about kind of long-term planning with folks and really trying to create income stability and with kind of a realignment of services. And those things are great. I would fully support that. And we can't forget that these basic needs, housing, food, basic needs for health, especially for short-term needs, are incredibly important in our community. And this is what is surfacing more and more as we see economic strain. How do we think as a community about how to address some of these really basic things so that people don't lose their housing, they don't find themselves kind of further downstream with more and more significant needs. So I've already just said some of these things, but needs are interconnected, right? Most people did at least 2 searches. So we're looking for at least 2 things as they went through the online tool. So this underscoring of needs rarely happen in isolation, and we all know this in the room, right? You rarely have somebody surface that says, hey, if this one thing is addressed, everything else in my life is fine, right? There's a lot of interconnectedness to the things that we do. So when I think about this data, this really is upstream data. It helps us see, because it's a snapshot of right now. We could pull data from today. So we could say these 50 people today that did a search, this is what they need today. So it's very real time, it's very current, and this is one of the reasons that this data is so important to me and to the work that all of us do. It should help us understand where things are shifting and changing and allow us to adapt our delivery system accordingly. And then it allows us to strengthen proposals with evidence and coordinate services with others. If you're one of those organizations that's really focused on income stability over the long term, who should you be partnering with that does more of that basic needs kind of intervention in the short term, because those need to come together to really meet people's needs. And it helps us move from reacting to action overall. It helps, all of the data that we have helps make the challenges that the people that we represent, that we have the opportunity to tell their story, it helps make it more visible. So when a neighbor of mine said just a few months ago, I can't believe so many people in York County are impacted by the SNAP pause. So I get to live in this world every day. It wasn't a surprise to me, but my neighbor, really well informed, really community-minded individual, didn't have that number in her mind, and that number was really important to understand how many people depend on SNAP every day to feed their families. So I would challenge all of us to find those couple of data points that are really important to the work that we do and shout them from the rooftop so that everyone, regardless of their station in life, understands the broader community and where we are as a community. These are just a few questions to kind of prompt our thinking. And this is thinking about gaps, how to understand need, and particularly that emerging need, those things that people are coming out and asking for today, and how we can realign to better meet those needs, especially in this time of pretty rapid economic changes in our community and more broadly. So lastly, I would just close by saying that data helps us turn stories into evidence. And as a person who loves a good story, I know that I can't forget the data, and I have to be familiar, and I have to have it at my fingertips, and I have to know those 3 things that are really most important to the work that we do to engage people with, to understand, because it is that combination of the stories and the data that helps us move, not just community members to move to donate or whatever else we might like, but helps us maybe think about how to work together differently to help meet emerging and current needs in a more effective way for our community. I know that's what we all want to do, but myself included, it's very easy to get head down in the work, and we've got a lot of work to do right now. But if we don't pick our heads up and look to either side of our neighbors and friends who are doing the work along with us in the nonprofit sector, we're going to miss something in this time of rapid change. And our community is asking for us to look to each other to realign services and more effectively meet those emerging needs and urgent needs that are surfacing every day. Thank you.
this morning. I'm so grateful to be here with the other presenters and all of you today because I am proud to live and work here because we do stuff like this, that we share ideas and we get together and we say, how can we help each other help this community? So United Way has access to a bunch of data I want you guys to use and know about. And even if you don't love data, like a lot of us in here do, it's easy to use this stuff. So I'm just kind of demystifying it today. Sarah, give me a heads up if I go over my time, because I know I'm tight. Okay. So you guys all know ALICE. I'm not going to spend time on ALICE. It is asset limited, income constrained, employed. Bethany would be mad at me if I didn't tell you the acronym. So it's folks who make a little too much to qualify for most government subsidy programs, but not enough to feel secure. If we take York County, those that are living in ALICE and living in poverty, it's about 35% of our community, so it's a ton of folks. We partner with the United Way of Northern New Jersey for a subscription to United for ALICE. And this is a treasure trove of data about ALICE in our community. I know you can't see the screen very well, but unitedforalice.org. It's very simple, it's free, it's open to anyone here because United Way of Pennsylvania and United Way of York County pay into receiving this data. So you can go to United for ALICE, click state data, then click Pennsylvania, and you can get real great data on specifically York County. So I do have a laser thingy here. So you can pick the county reports, and it gives you very detailed snapshots by zip code. You can do it by legislative district, so you can go to Representative Scott Perry and say, did you know how many people in your community don't have access to high-quality childcare? So this data is really helpful in your conversations. It's also really fun to have that data at your fingertips, so when someone comes at you with a perspective that's not well informed, you can come right back with your data and cite your source, which is a lot of fun. So I also want to show you the other data tools that are available to you. We have the ALICE Income Status tool, which allows you to put in, oh no, that's the wage tool I'm thinking of. So you put in a wage, you put in a location, you put in how many kids in your households and their ages, and it tells you where they are on that ALICE or poverty spectrum and how hard it is to make ends meet in that community. The ALICE Essentials Index. It's kind of like taking the Consumer Price Index, the CPI, and putting it into the stuff you need, like your basics, like your housing and transportation and food, whereas CPI is more like consumables. This includes the stuff you need to like just make your ends meet. I told you about the legislative district tool, and there's a lot of reports in here as well that you can read and download, and it's all available to you. Then I want to talk about 211. So 211 in Pennsylvania is divided up into multiple regions, and I know you can't see the screen very well, but we are in the South Central region. So our 211 call center is Contact Helpline. So United Way of York County pays into Contact Helpline to have access for York County to it. Because of that, we get data back on what people are looking for. You can call 211, or you can go online and search 211. It's got multiple languages. It's available 24/7, 365. It's confidential. You can text 211 as well. And every month, I get a report of what York County folks search for in 211. And not shocking at all, it lines up very well with what Jenny presented. The top need by far is housing and shelter. And we anecdotally know at York County, the number one thing that people are asking us about is short-term rental assistance. That is the number one need. And I know that emergency food and shelter program in York County is being held up currently by the federal government. And so that was a major source of funding for emergency shelter and rent assistance, which is not happening right now. We also have the top 10 referred agencies, and the top referred service, rental assistance, is number 1. Top unmet needs. This is very, very important. because it's helping us identify what we need to be doing as a community to fill that gap. Automobile payment assistance. So, York County, United Way of York County is looking at transportation. And this is the reason, is that there really isn't a smooth, simple solution for people who have a car and they want that car to run because it's their lifeline to economic stability and they just can't afford it. And we all know that there's predatory loans out there and they're getting into challenging situations with keeping up with those car payments. Automobile loans, automobiles, the top 3 unmet needs are related to transportation. We also have demographic breakdown. You can see it's mostly females doing these searches. Working age adults, 25 to 34. We have top zip codes in York County. They're all right around the city of York and Hanover. We have ethnic demographic breakdown and household income. The other thing is you can see that the vast majority of people are not veterans. And so we recently had someone say to us, I need assistance, but I don't have anything, this is what they said, and it's not PC, I don't have anything else wrong with me. And what they meant was, I don't have a disability, I'm not a veteran, I don't have all these other qualifying factors that would allow me to qualify for most of the programs that are out there. And while it wasn't said very eloquently, we understand what they mean, is that for someone who's just trying to make ends meet, who doesn't have any of these other secondary factors, there's really not a lot of clear answers for folks like that. If you want to change your 211 profile information, this is how you do that. We don't do that for you, I'm sorry. But this is the best way to do that. I do have this information and we're going to share the slides out afterwards. And I also want to make a plug for Policy Map that you now have access to because of ECHO. Every Child Has Opportunities. Policy Map is a very robust tool for overlaying demographic data as well as census information and income information. We have these great early childhood education maps already made about where childcare deserts are in York County and where there's too many slots. Believe it or not, there are some with a little bit more than the amount of kids in that area, and where there's drastically not enough slots. But you can use this for other things besides childcare. It can be transportation, it can be food. Just to know that this exists and it's available to you as a community. I think that's all for me. We okay on time? Okay, David.
Good. Well, sorry about that. Good morning, everybody. My name is David Gonzalez with the York County Economic Alliance. Serve as our Director of Economic Initiatives and Advocacy. I want to get started with Happy International Women's History Month. I want to share a quick data stat about the Economic Engaging Insights report from that kicked off the York County Collaborative's work. 54% of of executive directors are women in the nonprofit sector here in York County. Likewise, 69% of senior leadership also make up women, and 67% of the staff are women. So you guys are really driving this forward, and we want to commend you all for that contribution here in York County. And that makes up the population. It also makes up the small business side of York County too. I'll give you on that side. Entrepreneurs, business leaders are outpacing men by about 70% of businesses in the last 5 years are women-owned businesses. So again, I want to give that plug. Data slides are set up. I got probably 9 minutes now, so I'll try to get through this as soon as possible. Thanks again for hearing me on that. For the York County Economic Action Plan, I'll give you some context. In March 2020, we embarked upon an economic action planning. And heck of a time to do so, because a week later, we all went home as a result of the COVID-19 pandemic, and our economy changed dramatically. We launched the EAP planning process with 2,000 some stakeholders engaged. That was through interviews, that was through personal engagements, surveying, work group participation, all of that with the outline and approach to really kind of create alignment in that realm of economic planning. Likewise, for systems changes, where can we pivot? Where can we improve our processes that currently exist in York County? Likewise, and altogether, I mean, tangible economic progress and economic opportunity and mobility for all. That's the basis of If you drill down the economic action plan, it is 82 pages. It's 140 some action items. If you're looking for some light reading, I can send you the link directly afterwards. But if you want some quick sound bites, it's 7 different focus areas, all sort of interconnected as you can imagine. Future of industry, we're talking about the high industry throughout York County, manufacturing sector, construction, retail, healthcare, that really make up the fabric of York County at large. It's where major employers, it's how York County is known to many folks. When you think of Harley-Davidson, when you think of Wellspan Health, when you think of BAE, it's how a lot of people know York County to a degree. So we're thinking of the ideas there to how we can help innovate, how we can help strategize in the long term about what those communities and what those sectors can do for longevity, and also recruit different sectors to York County as well. Workforce development says in the name, it's developing our workforce for upskilling purposes, for education, to ensure that they're reflecting the current needs that we have coming and also in the long term. Entrepreneurship started off this presentation with talking about how women are crushing it. Well, the idea there is that we want to make sure that's sustainable in the long term as well. We see a lot of closure rates in the past 5 years. Think of your Main Street communities. Think of your favorite business that you walked into, restaurant. Some of them may not be here. We want to make sure the sustainability of that in the long term, and the efforts through the Bloom Business Empowerment Center and many others are helping to contribute to that. Economic mobility, says in the name, is making sure economic opportunity stands for all York County residents. Quality of place comes down to placemaking for the sake of it all. It comes down to our third places. When you're not at work, when you're not listening to me present here, when you're not at home, it's those other places. It's the places where you want to gather, the cultural assets in our community, the parks and recreation, where you meet your neighbors. It doesn't matter your income, doesn't matter your economic standing here in the county. They're all just one individual enjoying the assets in our community. So that's what we talk about. Infrastructure in the built environment, I can say utilities kind of covers the gamut there. We heard earlier about just the strain that utilities are providing on households at large. So when you think about internet, when you think about electric, when you think about gas, when you think about roads and bridges, we want to make sure that there's a sustainable path forward to ensure that those are continuing to be an economic enrichment for us and not a deterrent. And rural economy, well, we all like to eat, and we all like to have access to the supply chain. In York County, we have some great agricultural lands. We want to make sure that they're sustained for the long run. Last year, we did a midpoint review. It was sort of a progress report on where we were with the economic action plan. We captured this internally. About 92% of the action items in the EAP were either in progress or were completed, and that is great on the surface. But the idea there is that was it actually meeting the needs at large, and that's what we wanted to do in the review process. So as you can imagine, we conducted interviews, we developed some impact reports, which are on the EAP website, and I'll share that later. Also used the opportunity to retool a bit. As you can imagine, a lot of data came out since we adopted the plan in 2020, local, state, and national. So we wanted to inject that as well, and also pay attention to the economic conditions that are broader outside of York County borders. So a very quick data update because I don't have much time, but I want to give you some context. So notable stats on the EAP data review. I mentioned entrepreneurship, 2.6% business birth rate increase from 2018 to 2023. That is promising. That is great. And we want to see that continue to be sustained in the long term. Workforce education, 7.4% job creation rate increase across York County. Again, that is proving that we're moving the needle in that respect of seeing that. And these two stat lines are outpacing state averages. So when you go to your friends in other counties and you tell them, York County is crushing it, that's because of all of this. Future of industry, it kind of combats that last stat line I just gave you. It's 1.1% establishment death rate has seen an increase. That's a cautionary tale. It's very specific to some highest among the firms between 20 and 499 employees, but it's about 20 or so firms in that stat line. So it's a lot of supply chain focused groups. With the conversations of onshoring and reshoring, that could change in the years to come, but just wanted to make sure that's a cautionary tale. And rural economy, I mentioned it earlier, 7% decrease in the number of farms from 2017 to 2022. That's because the cost to purchase farms in the first place is harsh. The legacy transitions, we have some issues there, and also just the workforce. These are 100-acre farms or more that we saw a concerning closure rate on. So we're tracking our progress. So there's a host of tools and efforts that we have on the EAP website, one of which that we just unveiled is a benchmarking dashboard, where we're actually comparing ourselves to communities across Pennsylvania and also communities like Summit County and Guilford County, both in respectively Ohio and North Carolina, that are similar in size and scale in York County. They have similar population, they have similar educational breakdowns, ALICE populations, household incomes. So we're comparing ourselves against pretty much our competitors. So we see the opportunities there to make sure we're all aligned with the EAP and see where they're doing well in future of industry, where they're doing well in workforce development, where they're doing well in quality of place, how are we scaling up as well. So you see, here's a quick benchmark tool about the median household income of just the populations. It's more interactive on the site. It's a little messy right now when you look at it firsthand, but again, it gives you the snapshot of where we stand in the different demographic breakdowns. Getting some feedback, so hopefully that doesn't bother too much. I'll give you examples of EAP can be used, and this is sort of what I want you all to take away from the presentation as well, that there's variations of the economic action plan I mentioned. There's 142 action items. There are ways that all of you can engage in this, and we've engaged many of you already to date. So from ECHO standpoint, which is every child has opportunities, it is a strategic focus to focus on early childhood education and strong correlation of workforce stability in a healthy economy. So that's sort of what the reference is in the EAP. Prior to the pandemic, prior to the adoption of the economic action plan, we knew there were challenges and gaps in child care. The pandemic, no surprise, increased that gap. In 2022, we set out a goal to double the number of low-income children served by high-quality ECE. That was about 1,600 students we were targeting. But in 2025, through our policy map efforts, through our gap analysis that we worked through with ECHO that Laura mentioned earlier, we saw that there are about 21,000 students ages 0 to 5 years old, and we only have about 12,000 seats for them. Now granted, some of those individuals stay with family members, stay with friends throughout the course of it, but there's definitely a significant gap that we're still experiencing. So that's what that work for EAP has raised up the effort, put ECHO in, put a lot of our partners in work and action to really kind of get this to a solution. In housing, I'll give you context. We talked about it earlier. Reference in the EAP is access is noted a challenge. In the EAP, there's one line that says, conduct a needs assessment to determine what housing is needed throughout York County. But that has started a firestorm in efforts that we've embarked upon. So the challenge is in 2008 actually, since 2008, we've seen a construction slow and has never really reached pre-recession numbers. The building permits have slowed across York County. Redevelopment and rehab is difficult due to costs, workforce constraints, existing policy. So again, we're hitting this issue head on. And I'll give you one solution here that we addressed. Again, in the conditions and needs assessment, we are looking at the figures here. I'll read it for the folks in the back. Age of homeowners in York County is under 55. We saw a decrease in that. So 2010 was 57%. In 2020, it's 47%. Age 20 to 34, so the young generation that wants to purchase a home, is actually continuously not having their name on leases and also not having their name on mortgages as well. So 30% are neither homeowners or renters. Median sale price in York County as of 2026 is $299,000. To afford it, saying at a 30% of your household income would go to that mortgage, you have to earn about $92,000 in household income. Partnership-driven workforce development is what we've been working on last year, and we are doing this year. Last year, we partnered with the York Builders Association Workforce Now Foundation. Thank you to Melissa, I know you're here. We had 25 participants enroll in 2 cohorts. That was 20 graduates, 60-plus hours of comprehensive training. And comprehensive training is broad. It's the fundamentals of blueprint reading, the fundamentals of drywall installation. We're doing some different additional cohorts in the next year as well. And that costs about $102,000 in total program investment to do that. We see that as a significant need because when you have a contractor, if anybody in the room has tried to secure a contractor, you know the conditions there. You're waiting for quite a while. That's not a bad issue when you're trying to renovate your bathroom for beautification purposes. That's a bad issue when you're trying to get your roof replaced or get it patched up when it's raining like this. And I'll get the last point because I know I'm really tight on time. Data analysis efforts from the YCEA. We are partnering with a lot of different partners in the room and throughout the county to use our shared data that we have. We sit on a lot of information as a community, so we're trying to see how we can better conduct mutual analysis that helps us tell a better story. We know federal data and statewide data is there. the local data helps tell the better story of what's actually going on in the surface here in York. So a lot of local context to help fill that gaps. We started the effort this year to do a quarterly economic report in-house. That's that high-level insights of just where we're at as a community from an economic standpoint, and we'll be doing some more targeted focus reports in the year to come. Some other tools that you have for yourself that you can access right now on the EAP and YCA website. We have a local intel profile that pretty much provides you in-depth context of where we're at as a community at large. So it's that quick information, so you don't have to Google or use the AI chatbot to figure out where we are as a median population. It's just right there for you already. So it's quick and accessible analysis of just where our top employment sectors are, our household income, our population. It's there. If you want more additional insights, we have additional events happen each month. We have Russell Redding, shameless plug here, who is talking about agricultural and development, and we have more upcoming events too. Business of live music, capital campaigns, healthcare. June, we take a break, but regardless, you have some upcoming events there for you, and we'll take any questions.
Thank you so much. You guys all did a great job speeding through, but still giving us great information. So appreciate that. We'll now open it up for questions. Jason Andrews from our team is there. If anybody has any questions, he will bring a mic to you. Any questions from the audience? Okay, you guys can't be hungry. We have breakfast. You guys want to get back to work? Okay. Last call for any questions. Okay, great. Hearing none, Jason, you're off the hook. Thank you again to each of our presenters for sharing your expertise, your data, the sites. We really appreciate it. You will get all this information, all the slides for your records. Again, thank you to the great work in the collaborative. Thanks for your support and have a great day. We do have the survey, so if you can respond to that, that would be great. The QR code, if not now, in like the next couple of hours. Thank you. Have a great day.